Today we're going to be looking at infertility treatment and specifically the options available in India. Before we even get into that, I think it might be helpful to level set and talk about what infertility even is.
Yeah.
Because I think it's a term that people hear thrown around, but they might not actually know
Yeah.
like what that really means clinically.
Yeah, for sure. So clinically, infertility is the inability to conceive after 12 months of regular unprotected intercourse. And it affects a significant portion of couples worldwide. Actually, the CDC estimates that 1 in 8 couples in the U.S. struggle to conceive.
1 in 8. Wow. That's a
It's
lot of people. So, I mean, with a problem that big, obviously there's going to be a lot of different causes.
Oh, yeah, absolutely. And, they can stem from either male or female factors or a combination of both.
Right. And I know it's best in India actually breaks it down kind of into those two categories.
Okay.
So for women, they list things like ovulation disorders, blocked fallopian tubes, PCOS, endometriosis, and uterine fibroids. And on the male side, it lists things like low sperm count, abnormal sperm morphology, motility issues, varicocele, and even some genetic disorders.
Yeah, that's a pretty thorough list.
It is.
Oh, yeah.
So, I mean, obviously there are a ton of potential issues. And I'm assuming with all these different potential issues, there are a lot of different treatment options too.
Definitely.
So one of the, I guess, most common ones that people have heard of, I think, is IVF,
Right.
in vitro fertilization. Can you walk us through what that actually looks like?
Yeah, so IVF is a type of assisted reproductive technology, or ART. And the process starts by stimulating the woman's ovaries to produce multiple eggs. And then those eggs are retrieved through a minor surgical procedure.
Okay.
And then those eggs are fertilized with sperm in a laboratory setting. And then those resulting embryos are monitored. And the healthiest embryos are selected and transferred back into the woman's uterus in the hopes that implantation occurs.
Okay, so it sounds like a pretty involved process.
Yeah. Yeah, it can be.
I mean, both physically and emotionally, I would think.
Yes, definitely.
And I did see on the website, too, that they mentioned it can be an expensive procedure.
Yeah, that is definitely one of the downsides.
Which makes sense with all the technology and the different specialists involved. But it seems like they're also trying to emphasize the effectiveness,
Yeah.
especially for women under 35.
Right. For women under 35, the success rate for IVF can be around 30%.
30%.
Okay. But, that's just an average. The success rates can vary based on individual factors like age, the cause of infertility, and the clinic's expertise.
So a lot of factors go into it.
Yeah, for sure.
So 30% is a decent chance of success, I guess, but it's definitely not a guarantee.
Right.
And there are also other options available, right?
Definitely.
IVF isn't the only way to go.
Not at all.
And actually, Best in India does list a few alternatives to IVF, like intrauterine insemination, IUI, ovulation induction therapy, and surgery. So maybe we can dive into those a little bit. So starting with IUI, what is IUI? And how does it differ from IVF?
Yeah, so IUI is a less invasive and less expensive procedure compared to IVF, and it involves preparing a concentrated sample of sperm, which is then directly inserted into the woman's uterus during ovulation.
So it's kind of like giving the sperm a head start.
Yeah, you could think of it that way.
So, but that probably doesn't work for every type of infertility, does it?
Right. It's typically recommended for cases of mild male factor infertility, unexplained infertility, or when there are issues with cervical mucus,
Okay.
which might hinder the sperm's journey.
Gotcha.
It's not as effective as IVF for more complex cases.
Right. Okay. So then what about ovulation induction therapy? What does that involve?
So ovulation induction therapy uses medications to stimulate ovulation in women who are not ovulating regularly or not ovulating at all.
Sure.
And these medications essentially mimic the natural hormones in the body that trigger egg release.
So it's like kickstarting a natural process that's not happening.
Exactly.
Okay.
And it's often used in conjunction with other treatments like IUI or IVF to increase the chances of success.
Okay, that makes sense. And then lastly, they mentioned surgery as an option.
Yeah.
So I'm assuming that's for very specific cases where there's some kind of physical obstruction.
Exactly. Surgical interventions are typically recommended when there are anatomical abnormalities that are hindering conception.
Okay.
So, for example, if a woman has blocked fallopian tubes due to scar tissue or endometriosis, surgery can be performed to try and repair or unblock the tubes.
Okay, so it's more about correcting a physical issue
Yeah,
rather than stimulating something.
exactly.
Okay, so it's interesting, all these different approaches.
Especially for infertility treatment.
Yeah, I noticed that too. They definitely seem to be playing up the potential cost savings compared to treatment in like Western countries or something.
Yeah, exactly. They highlight the fact that a lot of their partner hospitals have cutting-edge technology, and they adhere to international standards, so they're offering high-quality care at a fraction of the cost.
Yeah, I mean, it's a compelling argument.
Yeah.
It makes you wonder, what are some of the factors that contribute to those lower costs?
Yeah. Well, I mean, there are several factors at play. One is the lower cost of living in India, which obviously translates to lower operational costs for the hospitals.
Makes sense.
Another is the sheer volume of patients that a lot of Indian hospitals treat, which allows them to offer more competitive pricing.
Right. Yeah, that makes sense. And I've also read that the Indian government has been actively promoting medical tourism as a key industry. So I wonder if that also leads to like incentives and support for these healthcare providers who are catering to international patients.
Yeah, I think that definitely plays a role. Government support can really help make healthcare more accessible and affordable.
For sure. Best in India does provide a lot of information about their partner hospitals and doctors. We're kind of nearing the end of our deep dive here. We've covered a lot of ground, from the causes and treatments of infertility to the nuances of seeking treatment in India. What are some key takeaways you'd want our listeners to remember as they're considering their options?
Well, I think the most important takeaway is that infertility is a complex issue. There's no easy solution. It requires patience, research, and informed decision-making.
I totally agree. And, a website like Best in India can be a really valuable starting point. Listen to your own instincts. Prioritize your own needs and values.
Yeah, I think that's great advice. And remember, you're not alone in this journey. There are tons of resources, support systems, and communities out there to guide and support you every step of the way.
That's great to hear. And I think on that note, we can wrap up this deep dive, hopefully leaving our listeners with a sense of empowerment and a renewed commitment to seeking the knowledge and support they need.